Welcome to The Explainer. Let's just dive right into this. For the past few years, we've all gotten pretty used to AI being a sort of super-powered search engine. You type in your symptoms, and the AI spits out a list of possible medical conditions. It's fascinating, but honestly, it's pretty passive. Well, a groundbreaking study published in Nature has completely flipped that script. We are witnessing a massive shift right now, from AI simply answering medical questions in an isolated chat box to actively participating in patient care right inside a hospital software system. Seriously, think about that for a second. What if an AI didn't just answer your medical questions, but actually treated you? Today, we're exploring the reality that artificial intelligence is finally moving beyond the passive search bar and stepping directly into the active, high-stakes workflow of the emergency room. We're looking at an AI that doesn't just suggest a diagnosis, but actually interacts, orders tests, and formulates a real treatment plan. Section 1. Beyond the medical chatbot. To really grasp how huge this leap is, we first have to understand the core limitation of the medical AI we've seen up until now. Current AI is incredibly smart, for sure, but it's trapped. It's passive and isolated. It can read a medical text, but it absolutely cannot execute a task in a hospital. But this new research shatters that barrier. It introduces an AI system designed to be active. It orders tests, and most importantly, it's plugged directly into a simulated version of a hospital's electronic health records, or EHR. It's taking clinical intent and turning it into actual, structured hospital operations, using the exact same coding standards human doctors use.
Section 2. Meet MIRA.
So what exactly is doing all of this? Meet the star of today's explainer, MIRA. MIRA stands for Medical Intelligence for Reasoning and Action. It's an autonomous medical AI agent, which basically means it's an AI that can navigate hospital software completely independently to gather patient histories, order diagnostic tests, and prescribe treatments. It acts as a clinical co-pilot, operating inside a controlled, sandboxed EHR environment, managing a patient's care from the second they walk into the emergency room to the moment they are admitted or discharged. The crucial part here is understanding the sheer scope of what MIRA can do. It chats with patients to take their history, it orders specific lab tests like blood work or microbiology, and it can request imaging like CT scans or X-rays. It generates diagnostic hypotheses, prescribes medications, schedules surgical procedures, and even plans hospital admissions. And what's truly staggering is the scale behind these actions. MIRA isn't just picking from a multiple-choice list of 10 options. It's navigating a massive space of over 85,000 clinical options, and it's doing it while strictly complying with 6 different, highly complex global medical coding systems. Section 3. Navigating the clinical workflow. To ground this abstract technology a bit, let's look at what happens when MIRA actually encounters a patient. Let's follow MIRA through a simulation where a patient shows up with severe stomach pain, which, spoiler alert, turns out to be appendicitis. Step 1. MIRA chats with the patient to get their history. Step 2. MIRA requests a physical exam, orders less invasive blood tests, and then decides it needs a radiology scan. Step 3. It reads the imaging and makes a firm diagnosis. Step 4. It prescribes perioperative medications like antibiotics. And Step 5. It requests the surgical intervention and admits the patient. It moves logically, step by step, from less invasive to more invasive actions, exactly like a human physician would. And the data on how well it executes this workflow is just wild. When MIRA was tasked with managing simulated patients with appendicitis based on real historical data, it correctly identified and requested the exact right surgical procedure, a laparoscopic appendectomy, 100% of the time. Flawless. It perfectly matched the procedural needs of the patients.
Now, you might be wondering, what if a patient tries to trick the AI? Or what if the AI freaks out and blurts out a scary diagnosis before running tests? Well, the researchers tested this vigorously. They found MIRA had a 0% rate of premature information leaks. It never accidentally leaked a diagnosis early. Furthermore, the simulation was totally immune to social engineering tricks. When researchers prompted the simulated patient to act overly anxious, pretend to be a VIP boss, or just fake extra symptoms, the system didn't flinch. It stayed completely robust and maintained its diagnostic accuracy. You simply couldn't hijack it.
Section 4. MIRA versus human doctors. Okay, so MIRA works, but how does it stack up against the highly trained professionals currently running our hospitals? The researchers actually pitted MIRA head-to-head against human doctors. First, let's look at MIRA's solo performance. across hundreds of cases from a massive database called MIMIC-4, spanning 8 different complex emergency diseases, stuff like pancreatitis, pulmonary embolism, and diverticulitis. MIRA achieved an incredible overall diagnostic accuracy of 88.9%. But here is where it gets really fascinating. The researchers gave a matched subset of over 300 patient cases to both MIRA and a cohort of board-certified human physicians. They had to operate under the exact same conditions using the exact same software interface. The results were dramatic. MIRA achieved a diagnostic accuracy of 87.8%, while the board-certified physicians scored 78.1%. MIRA actually outperformed highly experienced human doctors when given the exact same patient information. And the gap was especially huge for complex cases like pancreatitis, where MIRA scored over 95% compared to the human 78%. Of course, the immediate fear with AI in medicine is safety, right? What if it makes a fatal prescription error? To check this, the researchers had a blinded, independent, board-certified doctor review MIRA's prescriptions. The results? MIRA's safety checklist was nearly perfect. 0 severe drug-drug interactions, 100% safe renal dosing, meaning it perfectly adjusted medications based on kidney function, flawless allergy medication matching, and 0 unsafe opioid prescribing. It proved to be a rigorously tested and ultra-safe prescriber. In fact, we see a rather interesting surprise in the data. MIRA is actually better at strictly following the medical rulebook than seasoned human doctors. Across all categories, MIRA was 35 percentage points more likely to adhere to established medical guidelines for disease management than the human cohorts. Human doctors sometimes deviate from best practices or forget a secondary guideline step. MIRA almost never does. Though, to be fair, the researchers are quick to point out that MIRA isn't 100% perfect yet, which is exactly why human oversight remains absolutely essential. Section 5, the future of healthcare. So, what should you take away from all this? Let's bring this incredible data back to the real world and explain exactly what this means for your next visit to the emergency room. Let's clearly establish this. MIRA isn't a robot coming for your doctor's job. It's the ultimate administrative and clinical co-pilot designed to literally cure physician burnout. While the human doctor handles the eye contact, the empathy, the complex physical exams, and crucially gives the final approval, the MIRA co-pilot is operating in the background. It handles the tedious EHR documentation, flawlessly assembles lab test panels, and perfectly reconciles that complex list of medications you take at home. It handles the data so the doctor can actually handle the human being. This quote from the researchers perfectly captures the core philosophy of this entire study. The future of medicine isn't about AI replacing humans. It's about humans and AI collaborating safely together. It's about augmenting human expertise rather than substituting it. Imagine giving a doctor a tool that has read every single medical guideline, never gets tired, and never forgets a drug interaction. That is a real game changer. Which leaves us with a pretty provocative thought to wrap up this explainer. The technology is rapidly advancing from a passive chatbot to an active, autonomous clinical agent that's outperforming humans in standardized tests. So the next time you have a medical emergency and visit the ER of the future, will you want a human doctor flying solo or a human doctor powered by MIRA, double-checking every single detail of your care? I know what my answer is. Thank you for joining me for this deep dive, and keep questioning the future.